Hey, yes, my good people, welcome back to our YouTube channel. Guys, in this video, don't try to swipe it because yesterday at the Senate, mambo ilichemuka. Health CS DEBORAH alionyeshwa kivumbi upande wa Senate, Edwin Sifuna and Senator Onyonka. Guys, nilikwambia kwamba sifili poa. So, you will allow me to play a video for you. Kisha kwenye comment section, you are going to tell us what's going on hapa nchini Kenya. Make sure unawatch hii video mpaka mwisho. But before we listen guys, ensure me like video kama kawaida. Guys, nimekuwa nikikwambia kwamba hii channel imekuwa ikisupportiwa na wewe na imekuwa ikishikiliwa na wewe. So sina budi ila kusema thanks so extensive kuendelea kusupport hii channel. Na zile moments tena unaenda kuchukua kulike hii video, acha Mungu akutetee na akupiganie tu ili ukaweze kuprosper. Kwa hivyo guys, let us listen jinsi ambavyo mambo yalichemka pale. Things are boiling nicely. Hama jamaa imefika mahali ambapo sasa wanasema ya kwamba it is too shy fanyi. So let us change to NHIF penye tulikuwa juu. Hiyo kitu ilikuwa ina work. Ilikuwa inasaidia watu zaidi. Sikiza.
You know, she's insisting that the SHA and NHIF are working. The reality is that everybody in our republic is talking about how that system doesn't work. In fact, I even want her to explain to me why NHIF was removed from providing the basic services. We knew that NHIF had issues of corruption and mismanagement in terms of the payments which were being, we knew all that. But you see, Mr. Speaker, what has happened is, I see the CS really struggling. Can I make a special request? See, because I had the majority leader make a contribution, and indeed, the speaker who left before you came in did not pronounce himself what we need to do. I believe that this matter cannot be interrogated on the floor of the House. Maybe we need to have it in committee so that we can spend even a whole day to run through the figures, to ask those critical questions, because everything I hear here, Mr. Speaker, is like this whole exercise is just a confusion and a rearrangement of things which I don't even understand. And Mr. Speaker, I'm not very literate. I'm averagely somebody who's been to school. So can we, as a Senate, ask the CS so that she can go and prepare herself, so that she can bring we go through this with a tooth comb, so that once and for all, we may be able to decide, is it working or it's not? If it's not working, we go back to NHIF and fix it so that it continues working, because NHIF was doing better than what is happening right now. Thank you, Mr. Speaker.
Senator Hamida, and please be brief. We need to move to the next question.
Thank you, Mr. Speaker. For me, I will. In fact, I just want to remind Madam CS and even the PS, Harry, who was there, that I told you, make us your friends. We shall work with you. Convert us. I mean, have time with the Senate. In fact, I had even offered that we shall mobilize through my chair, Senator Mandago. We shall mobilize the senators only and have time with us to take us through, then we'll understand and we shall walk the talk. But unfortunately, that has not been done. Just a quick one, Madam Waziri. The standoff between the private and the government, the same SHA. I mean, looking at the digital claims right now, they're being processed in a way that they have been plagued with failures, Madam Waziri, forcing providers to revert back to the manual system. And also you're talking about the success story and the success rate for patients' verification problems are still there, Madam Speaker. So kindly just address the standoff between the private hospital and the government hospital for the date, of how you're planning to resolve the crisis. Thank you.
Senator John Yutu.
Oh, thank you, Mr. Speaker. I join my majority leader in saying that the Senate should be given equal recognition, if not more recognition, by the ministry, especially because health is devolved. I only hope and pray that that is not aimed at maybe preparing ground for laying off some people, Mr. Speaker. But coming to my question, especially regarding the baby from Nyandarua, I would like the CS to tell this House, Mr. Speaker, what SHA is doing for patients whose medication is not available locally, Mr. Speaker. And I say this because there are very many rare diseases. I don't know whether she knows about Gaucher's disease, which is a rare disease and whose treatment is not available locally, and where aid is given. Mr. Speaker, there are very many and high taxes paid, charged by the government from those donors. So what exactly is the position of rare diseases, especially those whose treatment is not available locally, and what is SHA doing about the same, with specific reference to Gaucher's disease?
I've always suspected that the majority leader is a good man, because whenever we come to critical junctures where we have to close ranks and say if something is working, it's working, if it's not working, it's not working, he has always done so. And that is the conversation we've been praying for in this country. Honorable Speaker, and Madam CS, you're present here. The President, I heard him yesterday saying he pays 50,000 Kenya shillings for SHA. I very painfully pay an average of 32,000 Kenya shillings every month to SHA. And I say painfully because Majority Leader, you will recall that when that bill was here, I proposed an amendment to cap that contribution at 5,000. Unfortunately, that time, when a Majority Leader, you are not as good as you are this morning. You allowed the you voted to defeat that amendment, Honorable Speaker. But I want to cut through the noise, because here in Nairobi, they say, hatutaki mambo ya kizungu mingi. Now that the President told us that if we remove that capping, that if all of us pay according to our abilities, we will end the specter of harambes to raise money for healthcare in this country. Can the Cabinet Secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a harambe for this weekend to get payment for a loved one to obtain healthcare, including that baby Ariana, Honorable Speaker? Can she confirm that to the country? And if she cannot confirm, then she should be gentle enough, should be kind enough to tell us today that this thing is not working, that we should go back to the wisdom of Sifuna when we were having this conversation in this House. Regarding the challenges facing the SHA rollout of the new Social Health Insurance Fund. Honorable Speaker, you can see that despite the fact that the Cabinet Secretary for Health was here in the morning, questions continue to abound. And Honorable Speaker, while she was here, after I had made my comments, and you know the rules of this House don't allow us to speak twice on the same issue, my phone was inundated by messages from this Universal Health UHC workers. Because as you know, Honorable Speaker, after the Gen Z movement, my number is now a public number. It was disseminated to just about everyone in the country. Honorable Speaker, out of the more than 500 messages that I got, I distilled the three issues from what those UHC workers were telling me. And these are matters that I think the committee now has to have a very intimate session, both with the leadership of the ministry and even these UHC workers themselves, Honorable Speaker, so that we get to the bottom of these matters. Number one, it is the opinion of these UHC workers that the Cabinet Secretary for Health, DEBORAH, might have misled this House on the question of whether all UHC workers have actually been put on permanent and pensionable basis. That in fact, Honorable Speaker, the ministry only confirmed the people working, or the UHC workers at the national hospitals, and that in fact 8,572 of those UHC workers are still on contract for the last 5 years. This is a matter that the committee must get to the bottom of and report to this House. Number two, Honorable Speaker, it emerged that UHC nurses have been on strike for 3 weeks, Honorable Speaker, demanding to be put on similar terms to their colleagues who are working in these national institutions. And Honorable Speaker, they are saying that the ones who are not put on PNP, although they do the same work, in fact they face the same workload, they are being paid up to a quarter of what their colleagues are earning because of the status. Honorable Speaker, they also told me that they have not been paid gratuity since the days of Corona in 2020. These are the messages that I received on my phone. And I'm hoping, Honorable Speaker, that when the committee sits down to deal with these questions from Senator Hamida and Senator Mundigi, that they will deal with this issue. Lastly, Honorable Speaker, I could also discern from those messages that the UHC workers are saying that there was a supplementary budget that was passed in the National Assembly for absorption of UHC workers. They just want to know, where did that money go? And unfortunately for me, Honorable Speaker, I had already spoken and I didn't get opportunity to ask that question directly to the CS. But now that this matter has come up again and it is being committed to the Committee of Health, I would want to encourage the Committee of Health led by Senator Mandako. Let him invite these UHC workers in the same room as the Cabinet Secretary, because, Honorable Speaker, the only way to get to the bottom of the truth when there is blame game, and they're also saying they're tired of the blame game between the government of Kenya, the ministry, and all other players. Can we have all these people in one room with the minister and let them get to the bottom of these issues? I thank you, Honorable Speaker.